Every morning, standing alone at that bathroom mirror, you tilt your chin up toward the ceiling, stretching your neck as long as it will go, just to see the skin pull smooth and taut the way it used to look without trying. And then you lower your chin, watch everything fall back into those folds, and you walk away without saying a word to anyone about what you just did. If you are over 50 and that is your mirror ritual, this video is built around the exact biological event happening inside your neck right now. The real cause has a name: platysmal muscle collapse with SMAS layer detachment. If you do nothing, this process will pull the jawline down, deepen the nasolabial folds, and begin affecting the lower face within the next 12 to 18 months. And the 4 movements that begin reversing this are ones you can do standing at that same mirror, starting today, for free. Before we go any further, I want you to do a quick 2-question self-check right now. Question 1. When you tilt your chin up toward the ceiling, does your neck look significantly smoother and tighter than it does at rest? Question 2. Does your neck look noticeably worse in photographs than it does when you look in the mirror directly? If you said yes to both, type yes in the comments right now. Because later in this video, I am going to explain exactly what those 2 yes answers tell me about what is happening inside your neck, and you will want to come back to your own comment when I get there. Let me take you inside the neck, layer by layer, so you can see exactly what is happening. The outermost layer is the epidermis, the surface skin you can see and touch. Beneath that is the dermis, the collagen-rich layer that gives skin its firmness. Below that is subcutaneous fat. And beneath all of that, running like a broad, flat muscular sheet from your collarbone all the way up to your jaw, is the platysma muscle. This is the primary structural support for all the tissue above it in the neck. Anchoring the platysma to the skin above it is the SMAS, the superficial musculo-aponeurotic system, the biological scaffolding that mechanically couples your neck muscle to your overlying skin. When the SMAS is intact and the platysma is strong, the skin is physically pulled upward and held in position. When the platysma atrophies and the SMAS fragments, the skin detaches from its muscular foundation and descends under gravity. Think of it like a theatrical curtain attached to pulleys and ropes. When the pulley system is strong, the curtain hangs perfectly flat. When the pulleys weaken and the ropes slacken, the curtain bunches and falls in uneven folds. No amount of ironing the curtain, no cream, no mask, no device, will fix a failing pulley system. You must restore the ropes and pulleys themselves. Root factor 1. Platysma muscle. Atrophy. The first factor is one that most discussions skip entirely, and it is the one driving everything else. The platysma is the only major muscle in the human body that the vast majority of women have never consciously activated, not once, in their entire lives. Every other muscle you have, glutes, biceps, core, you have trained or at least used intentionally. The platysma has simply been there, doing its job passively, never asked to work harder. And like every muscle that is never loaded, it has been quietly atrophying for years. The platysma is not engaged by walking, yoga, swimming, or any conventional exercise. It requires specific directional activation, a downward pulling grimace motion that exposes the bottom teeth and engages the neck cords, to receive any neuromuscular stimulus. Without that stimulus, the muscle receives no signal to maintain its fiber density. After menopause, estrogen withdrawal removes the muscle-building hormonal environment that was partially compensating for the disuse. Postmenopausal women lose skeletal muscle mass at a rate of 1 to 2% per year, with thin, sheet-like muscles such as the platysma showing the earliest and most pronounced atrophy. Here is your solution. Twice daily, once in the morning and once in the evening, perform the platysma activation sequence. Pull the corners of your mouth wide and downward simultaneously, exposing your bottom teeth, tightening the cords on both sides of your neck. Hold that contraction for 10 full seconds. Release for 5 seconds. Repeat 10 times per session. That is 2 minutes of work, twice a day, that directly loads the exact muscle responsible for the visible draping you are trying to reverse. Cost: 0. Equipment needed: your bathroom mirror. Root factor 2, SMAS layer collagen fragmentation. The second factor explains why women who do have some muscle tone in the neck area still see the skin drooping. The SMAS layer is the biological bridge between your platysma muscle and the skin above it. Think of it as a fibrous net that physically stitches the muscle to the skin so that when the muscle is taut, the skin is pulled taut with it. When the SMAS collagen fragments and thins, the skin and muscle decouple. The muscle may still have some integrity, but the skin has lost its attachment to it and simply slides downward on its own. You might be thinking, I've been taking collagen supplements for years. Why is this still happening? Oral collagen supplements deliver amino acids into general circulation. The body then decides where to allocate those building materials based on metabolic priority. The SMAS, being a low-priority connective tissue layer, receives a very low allocation. Targeted mechanical stimulation of connective tissue, applying specific physical pressure and movement, increases local collagen-producing cell activity by up to 45%, with these cells responding to the mechanical signal by upregulating collagen synthesis specifically in the stimulated region. Here is your solution. Make bone broth at home using chicken bones. Place the bones in water, add 2 tablespoons of apple cider vinegar. The acid draws collagen precursors out of the bone matrix, and simmer for a minimum of 12 hours on low heat. Drink 1 cup every morning. The peptides extracted through this process are direct precursors to type 1 collagen, the specific type used in SMAS repair. A weekly batch costs under $5. Root factor 3, forward head posture. The third factor is hiding in plain sight. And once I show it to you, you will never sit at your phone or computer the same way again. The position your head spends most of its day in is actively compressing and reshaping the fascial tissue on the front of your neck, the exact tissue whose structural integrity determines how your neck skin looks. For every inch the head moves forward of its neutral position over the spine, the effective weight the cervical spine must bear increases by approximately 10 pounds. The average woman over 50 carries her head between 3 and 5 centimeters forward of neutral baseline. That is a chronic, sustained mechanical load pressing the front neck fascia into a compressed, shortened, thickened state. When the anterior cervical fascia is chronically compressed, it thickens and loses its sliding mobility, creating a stiff, inelastic tissue environment that further impairs platysmal function. The platysmal fibers are mechanically stretched in the wrong direction, pulled forward and downward rather than held upward. Here is your solution. Twice daily, morning and evening, perform the chin tuck sequence. Sitting or standing with your spine tall, gently pull your chin straight backward, not downward, not upward, directly backward, as if you are trying to make a double chin. Hold for 5 seconds, repeat 15 times. Immediately follow with a 20-second neck extension. Tilt your chin gently toward the ceiling, feeling the front of the neck lengthen and decompress. 3 sets of this combined sequence, twice daily. Root factor 4. Submental fat and lymphatic pooling. The fourth factor explains the heaviness. Not the looseness, not the banding, the heaviness. The feeling that the tissue under your chin has substance, volume, a gravitational pull of its own. After menopause, hormonal shifts trigger a preferential redistribution of subcutaneous fat toward the central body, including the area directly beneath the chin. This fat does not necessarily increase in total volume. It relocates from the periphery inward. Even a small volume increase adds gravitational load directly on top of a platysma that is already atrophying. Simultaneously, the lymph nodes running down the front and sides of the neck slow their drainage rate significantly in sedentary postmenopausal women. Lymphatic pump efficiency in the cervical region decreases by up to 40% in women over 55 compared to premenopausal baseline. That reduction means fluid begins to pool in the submental and anterior neck tissue, adding volume, weight, and a doughy texture to an area that is already structurally compromised. Here is your solution. Every evening, apply a cold compress, ice cubes wrapped in a thin cloth, to the under chin area for 30 seconds, followed immediately by a warm cloth for 30 seconds. Repeat this thermal alternation for 5 full cycles. The temperature contrast causes the lymphatic vessels to rhythmically contract and dilate. Follow this each evening with 1 cup of dandelion root tea. Dandelion root acts as a gentle lymphatic activator and has been shown in clinical research to reduce fluid retention measurably within 2 to 4 weeks of consistent daily use. The 4 movements. Now I want to bring the 4 movements together as a sequence practice because each movement targets a different layer of the mechanism we have just discussed. Movement 1, the Platysma Press. Pull the corners of your mouth wide and downward, expose your bottom teeth, feel the neck cords engage, hold 10 seconds, release 5 seconds, repeat 10 times. This is your muscle rebuilding stimulus. Movement 2, the Cervical Reset. Movement 2, the Cervical Reset. Chin directly backward, hold 5 seconds, release, immediately followed by a gentle 20-second neck extension. 3 sets. This decompresses the anterior cervical fascia and restores the mechanical alignment the platysma needs to pull effectively. Movement 3, the SMAS Lift. Place the flat of both hands on your collarbone, press downward gently to anchor the skin, and then tilt your chin upward slowly, feeling the full length of the front neck stretch under controlled tension. Hold 15 seconds, repeat 5 times. This creates a gentle tensile load through the SMAS layer, mechanically stimulating the collagen-producing cells in the connective tissue bridge between muscle and skin. Movement 4, the lymphatic sweep. Using the flat of 3 fingers on each hand, begin at the collarbone and sweep upward with gentle but firm pressure along both sides of the neck toward the angle of the jaw. 5 slow sweeps per side. This manually moves lymphatic fluid from the anterior neck toward the lymph nodes at the angle of the jaw. Performed in this exact sequence, Platysma Press, Cervical Reset, SMAS Lift, Lymphatic Sweep, the 4 movements address all 4 root factors in a single 12-minute session. Practical protocol, here is your exact 4-week system. Week 1, structural foundation. Every morning, within 30 minutes of waking, drink 1 cup of homemade bone broth. Make your weekly batch on Sunday. Cover chicken bones with water, add 2 tablespoons of apple cider vinegar, bring to a boil, then reduce heat and simmer for 12 hours. Store in the refrigerator and reheat 1 cup each morning. Every evening this week, perform the thermal contrast protocol under your chin. 5 cycles of 30 seconds cold, 30 seconds warm, followed by 1 cup of dandelion root tea. Lymphatic drainage responds to consistency more than intensity. Missing a day resets the drainage momentum you built. Week 2, muscle activation begins. Continue everything from week 1. Add the Platysma Press to your morning routine. 10 repetitions, 10-second holds, immediately after you wash your face. Add the Cervical Reset in the evening. 3 sets of 15 chin tucks followed immediately by the 20-second neck extension stretch. Perform before your thermal compress protocol. Week 3, complete the movement sequence. Continue all week 1 and week 2 elements. Add the SMAS Lift and Lymphatic Sweep to complete the full 4-movement sequence. Perform the complete sequence every morning as one continuous 12-minute session. You are now addressing all 4 root factors simultaneously, every single day. Week 4, full integration. Continue every element from weeks 1 through 3. Add the bonus technique 3 times this week on alternate days. Separate 1 egg white into a small bowl and whisk it until slightly foamy. Add 1 teaspoon of rice flour and stir to form a smooth paste. Apply this mixture to the neck and under chin area with upward strokes. Leave it on for 15 minutes. Rinse with cool water. The egg white protein forms a temporary tightening film on the skin surface as it dries, physically lifting the surface tissue while the underlying movement protocol works on the structural layers beneath. Used twice weekly in week 4 and beyond, this surface technique amplifies the visible results of the structural work happening in the deeper layers. Now I need to speak to you directly, at your exact age, because the urgency and timeline of this protocol genuinely changes by decade. If you are in your 40s, your platysma is beginning to lose estrogen-driven support but has not yet reached critical atrophy levels. At this stage, the 4-movement protocol functions primarily as prevention, and the structural results will be visible within 4 to 6 weeks. If you are in your 50s, the platysma atrophy is in its steepest phase. The full 4-week protocol must be treated as a permanent lifestyle system, not a temporary intervention. Expect to see initial texture improvement within 3 to 4 weeks, with more significant structural lifting results appearing between weeks 6 and 10 of consistent practice. If you are in your 60s, fascial remodeling takes longer. Expect 8 to 12 weeks for measurable structural change, but the platysma responds to neuromuscular stimulus at any age because muscle tissue retains its capacity for growth throughout life when given the correct activation signal. Drop your age in the comments right now, so I can give you the sequencing and timeline that is accurate for your decade. Let me bring the 4 root factors together. Factor 1 is platysmal muscle atrophy, addressed with the Platysma Press, 10 10-second contractions morning and evening. Factor 2 is SMAS collagen fragmentation, addressed with 1 cup of homemade bone broth every single morning. Factor 3 is forward head posture, compressing the fascia, addressed with the Cervical Reset, 15 chin tucks followed by a 20-second neck extension, 3 sets. Factor 4 is submental fat and lymphatic pooling, addressed with the 5-cycle thermal contrast compress every evening followed by dandelion root tea. Together with the 4-movement sequence performed every morning, these are not separate interventions. They are one integrated system targeting one structural problem at 4 simultaneous biological levels. No clinic will teach you the 4 movements I shared today, because there is no procedure code for a chin tuck, no billing line for bone broth. The commercial aesthetic model depends on you believing that your body has lost something it cannot get back without intervention. This channel exists to show you that belief is incorrect. What you saw in that mirror this morning, that chin tilt, that moment of lifting and letting go, was not vanity. It was your body showing you exactly where the structural support has shifted and asking you to respond. Now you know how. Subscribe if you have not already. I will see you in the next one.